his testosterone increased by 360%. That's a huge improvement, and the main things we changed was...
Oh wow, already some of the things that you mentioned goes completely against what I believed was true. AJ Brookes is a certified functional medicine and nutrition practitioner, personal trainer, and peptide therapist with over 19 years of experience in the health space. He translates complex blood work data into personalized health protocols for high performers and athletes, known as the Superhuman Health Protocol.
Parasites aren't always the devil. Parasites can actually be very protective for the body. This is the problem I actually see a lot, is people just think about add. Like, what else can I add into my life? What other biohack can I do in my life?
You told me that not being sick for a long time is actually a bad sign.
Yes, there is a hierarchy approach to health. So level 1 is like the nourish phase, level 2 phase, the restore phase, and then we've got level 3, which is
If you got to choose what you would focus on first, would you build mental strength or physical strength?
I don't think we should be looking at either in isolation, and that becomes part of the problem. If we do, we have to recognize how they work synergistically and how one area, any area of health, even if we look into oral health, if we look into nasal health, if we look into neurological health, if we look into gut health, all of it is interconnected.
Yeah, because I think this is also something that really stood out to me before. There was this one clip from Piers Morgan and Chris Williamson, and they were debating the exact same topic, and they had a very different idea.
Oh, wow.
Yeah? So Piers Morgan was saying focus on mental health. Chris Williamson was saying to focus on physical health, physical strength first. And both had a good point, right? And I enjoyed both of their answers, but I think this is something that a lot of people face at some point when they want to optimize their life for performance, whether like physically, mentally, emotionally, right?
Yes. And this is where I truly believe we have to understand the person before jumping into conclusions. So through understanding an individual, we could then decide what is possibly the best route to take, whether it is going to be more of a focus when it comes to mental health or more of a focus on physical health. But either way, we have to understand that we need to address them both. So something I know we're going to dive into is how 80% of the vagus nerve fibers are afferent, which basically mean they carry information from the body to the brain rather than the other way around. So that means 80% of it, we've got to be looking into the physiological factors, not just the psychological factors, but we still got 20% where we need to be looking into the psychological factors there. However, as I say, that's not a one size fits all. We've got to understand where a person is at when it comes to their mental health. We have to respect that.
So it seems like that the physical health is extremely important also for your mental health. Like you said, it's 80%.
Huge. Like if we look into physical health, so just quickly to put it in a nutshell, which I don't always like to do, but if we look at it, it can help to mobilize immune cells. It can help with lymphatic system, which can help with obviously blood circulation, which can then help with nutrient uptake, which is then going to help with you mentally. So of course, physical health plays a huge role.
So if you think about that link, what are some of the most common hidden physical imbalances that cause mental or emotional instability for someone?
Awesome. So I'm going to meet the audience where they're at, because I'm sure that we've all heard how much your gut health affects obviously what happens with your mental health. So something that I like to look into is how leaky gut, which is intestinal permeability, can also cause leaky brain, but also leaky brain can cause leaky gut. So again, it very much shows that we shouldn't be looking at anything in isolation, because if we're only looking to gut health, we also miss the neurological health side of things as well. So there's this marker called zonulin, which is a key regulator of intestinal permeability, which has been shown to modulate the blood-brain barrier permeability. So basically when zonulin is high due to possibly gluten, it could be an infection, this can affect both the gut as well as the brain barriers. So that's a huge one.
Yeah, and that's just like one example, right?
Yes, I've got 7 if you want to. Obviously, we've gone through like the brain to body communication, from the vagus nerve fibers. We've touched on gut health heavily influencing mood and cognition, because obviously it's affecting the blood-brain barrier. Another one is also how chronic inflammation can affect neurotransmitters function. So if we look at that, where if someone's got an inflammatory response, that's then going to affect our neurotransmitters, which affects our whole mood. It affects our mental health, right? So all of a sudden, with this inflammatory response, can be signs which can then obviously cause things like anxiety or depression. So again, we may have to look at it from actually dampening and reducing the inflammation rather than looking at it as just a mental health problem.
Can you give a couple of more examples? Something that people tend to overlook?
Yes, definitely. So with this one, when it comes to chronic inflammation, or are you thinking just any sort of example?
Whatever you think is like very common that people don't even consider. They live their life by thinking that, oh, I actually do pretty well, right? Like I am healthy, I'm doing what I can, I try to get sleep, I try to get exercise, but something is still missing. So what is it that people still mess up even when they think that they are doing great for their health?
Yeah, cool. Okay. So this is where it comes into the hierarchy of health model, which is basically mirrored off the issue of health's priority of dysfunction. We've superhumanified it a little bit. So what I mean by that is we look into the foundations first, because a lot of people can look into the more advanced things rather than looking into what truly needs to be focused on in order to put the body into a position to optimize. So some things that we'd look into there are nutrient deficiencies. That's a huge one which so many people overlook, which is why we need to get blood work done to fully understand if there is a nutrient deficiency. And even beyond that, if there is a nutrient deficiency, what's causing that? Is it down to low stomach acid? Is it potentially down to bile insufficiency? There's many different factors which can obviously cause issues with digestion. Then there's the sleep factor of it. Like people could be looking everywhere else, but in reality, they're not getting enough sleep. And even if they are getting enough sleep, are they really dialing in on what parts of their sleep they need to optimize? Like, what is their quality of sleep actually like? Like, it's all well and good laying in bed for 8 hours, but how much of that is actually quality sleep? And then another factor is environment. Our environment is key. If you are living somewhere in a city, which is full of electric magnetic fields, for example, could this potentially be then affecting your health? If you're someone who lives in Bali, as an example, where there's a lot of mold, is that then going to play a role? Of course it is, because that can then obviously cause that inflammatory response in which we were just talking about. If someone's living a little bit more rural, then of course they're then out in nature. So their health can be completely different. I actually spoke to someone yesterday who had a lot of migraine issues. He said he's researched absolutely everything to do with migraines. I brought up electric magnetic fields and he was like, wow, how the heck have you just pinpointed that? Because now I think about it, when I used to live in the countryside, I never used to have headaches or migraines. And now I'm living in a city, I get them all the time and they last like 3 hours. And I'm like, one area which is so overlooked, EMFs. But yet people are trying to do everything else and not realizing the effects of that. So this is why we've got to look into it from, again, not even just one factor. Like it's not just about electric magnetic fields, because one, there's many things in which we can do to reduce the risk of that, but also someone's baseline can be very different to someone else's. So someone walking into a shopping mall may instantly get a headache, they may feel fatigued, they may just feel like something's off, whereas for someone else, they could feel absolutely fine. That tells us completely differently to where someone is at and what we need to prioritize at that moment. Is that a good enough example?
Oh, I think, yeah, absolutely. And I love
Yeah.
that you mentioned the environment because people just take it for so granted. Like, okay, this is what it is. And then even though that they try to have control over what they ingest, what they put in, like you can do a great job with that. But if your environment is still, how to say, like, toxifying you, then you are not really making that much of a progress because like also from my experience, Bali, mold, oh my goodness, like don't get me started on that topic. That's a
Yeah,
story for another day.
this is
But
it.
it happened at the end of last year that we had black mold where we lived and we didn't know. We just felt that we were tired, we were always exhausted, didn't matter how much we slept, brain fog. And I'm like, what is happening? Like, because even though like physically, when somebody looked at me like, okay, you look great, but what's up with your eyes, man? Like,
Yeah.
like big bags. You can definitely see it on the face that something is wrong. And guess what we did? We did a blood test, and yes, it was all there. So yeah, unfortunately, we
Wow.
had to change location. But again, like that's the control that we had over our environment. Either like you get rid of the mold, or you move, or you get rid of the EMF, or you move, right?
Yes.
So
And this is it. Like, it looks different for everyone. And when I say like environment, you just obviously brought one key point there. Like, if you're trying to have all this nutritious meals inside a apartment or house which has mold in it, your body is going to be in a sympathetic state. It's going to be stressed, which means it's in fight or flight. When in reality, what we need to be in when we eat is a parasympathetic state. Because if we just put into simple terms what a parasympathetic state is, it's rest and digest. Rest and digest. So if you're in that sympathetic state because your environment isn't favorable for you, then you're not going to be taking, assimilating, absorbing nutrients as effectively as what you could be, which is then going to have a host of effects on the rest of your health. And another one which I didn't mention, by the way, which is part of our foundations as well, is hydration and electrolytes. This is where a lot of people could take electrolytes, but if we look into most of the electrolytes which are marketed out there, they're very high in sodium. But does that person actually need more sodium or not? And then we've got the other factor that autoimmune is on the rise. And if we look into salt intake, because let's be honest, if we look into marketing online, again, it might actually advocate that salt is going to be very beneficial. But in reality, what it can cause is a Th17 response, which basically means it could cause an autoimmune flare up. So although it may be good for one person, it doesn't mean it's going to be good for you necessarily. But this is why we need the blood work to find out exactly what is going on with you as an individual. As you can see, I'm very passionate about this.
yeah, yeah, well, I can definitely see that, but you also have the experience with it
Yes.
already. So it's not just passion, it's also experience. So I know that you work a lot with entrepreneurs, founders, high achievers, people who like really put themselves out there to accomplish something in their life. Can you maybe give a couple of examples from the people that you have worked with that had some sort of like a breakthrough that did not come from psychological work like therapy or mindset, but from
Yes.
fixing their physiology?
Oh, wow. I've even got pet examples, believe it or not. I'll come on to that because it ties in nicely with this guy. So there's this one guy who's a men's leadership mentor. So obviously, as you can imagine, he runs a big program over in Spain for other males. Now, he was in a position where he knew something wasn't quite right. He just couldn't put his finger on it. When we got his blood work back, it actually showed severe candida overgrowth. So obviously, as we mentioned earlier, that can massively affect neurotransmitters, which then obviously affects the way in which he's showing up for himself. So this is where it gets more interesting. Because we put him on a candida approach and removed that, obviously that changed his life. But also what happened is his dog apparently had an incurable disease. Now, as he started explaining this to me, what I recognize is whether it's parasites or another sort of overgrowth, obviously what we have to recognize is that can obviously transmit from person to person or even from pet to person or person to pet. Like how our health is could affect our pets as well and vice versa. So when we went down the route of just trying things with his dog as well, he took his dogs back to the vet and they did a test. They did another test and another test. And they're like, this can't be happening. And he was like, what? Like he's almost started to get worried about it. And they were like, that disease is no longer there. But like, we never set that out as an expectation. But it just goes to show how many things you actually have to think about in order to optimize your health without overcomplicating it. But yeah, I really enjoy that story just because obviously it goes to show even if our pets are carrying a parasite, for example, that could then obviously pass on a parasite to us as well. So we have to be looking again into our environment. And when we say environment, it's not just the walls, it's the people we're with or the pets in which we're with as well.
So if I got this right, my dog can decrease my performance at work.
Yes, it could massively
Wow.
improve your performance, but it could also decrease your performance at work. So this is why we have to find out everything which is going on around you, which is why I say we don't just look at protocols, we look into people. And when we look into people, we look into everything to do with that person to truly be able to help them.
Wow. That's
Yeah,
crazy.
huge, isn't it?
So you mentioned something very interesting, which you call the hierarchy of health.
Yes.
What is the hierarchy of health?
Awesome. So I briefly explained that from a foundational level, but in a nutshell, what it does is it makes sure that nothing gets missed or overlooked, because I've had a lot of experience, as you said earlier. I've also worked with a lot of mentors and different practitioners myself through my own health challenges, and there always felt like there was something missed. So that isn't to blame anyone at all, but what it did allow the opportunity for was to recognize that actually there is a hierarchy approach to health. Like, we have to be looking at things from a foundational level. Like, you don't just build a roof on a house. Like, we've got to build obviously the concrete layers first in order to build on. So that's where we look into the hierarchy of health. So we make sure all of that is in a optimal position, or as much of an optimal position as we can realistically get it into at that moment in time. For example, if your sleep is poor, can we try and optimize that as much as possible? So I'm going to try and explain this in the best way possible. But foundational levels, as mentioned, we've got upper GI function, we've got nutrient deficiencies, we've got mental health, we've got sleep, we've got hydration and electrolytes, and we've got your environment as well. Okay, so that's the foundation. We always need to be focused on that. The next layer is then when we start to look into your barrier integrity. So that's, like I mentioned earlier, with leaky gut or maybe blood-brain barrier compromised integrity as well. And we've got detoxification pathways and we've got drainage pathways. Okay, so there's no point trying to go straight in with like detox protocols if you haven't got the foundation set up, because at the end of the day, coming back to the nutrient deficiencies, there's certain vitamins and minerals which are going to help with your liver detoxification pathways. So if you're deficient in them, why the heck are we going straight in with a detox protocol? It doesn't make sense, right? And another way that obviously we can look at that as well is, again, if we look into what helps with like detoxification, we could be looking into sleep. We could be looking into electrolyte balances. We could be looking into hydration. Like everyone says, in order to help flush things out and eliminate waste and toxins, you want to make sure you are as hydrated as your body possibly needs to be. So again, this saves us from jumping onto things too early. So that's like, we've got this nourish layer, we've got that restore layer, which is when we're looking into the barrier integrity, when we're looking into detoxification, drainage pathways. And then we've got the next layer, which is called the defend layer. And that's when we're looking into microbes, overgrowths, parasites. Because what we have to recognize here, all of these, of course, can be causing an overburden with your liver detoxification pathways. It could be affecting your sleep. But in reality, again, we can't just jump onto removing parasites. We can't just jump into removing bacterial overgrowth, because if we do that too early, that again is going to cause like an endotoxemia response. It's going to cause too much stress for the liver, because the liver isn't in a good position to eliminate and remove the toxins. So if we went straight in with antibiotics or antimicrobials, it's going to create this die-off effect, which could then harm our health even more. So now we actually, by taking this foundational approach, this hierarchy of health approach, we make sure that the body is in a stable position in order to truly optimize itself. And another magical thing I've seen from this is we've got to a stage where we've just focused on the levels 1 and 2 before going in with antimicrobials, and we've seen actually the overgrowths have resolved themselves because of everything else we've done below that. Because we've got the body into a natural position in order to heal, we haven't had to go in with all these antibiotics or antimicrobials, because the body is now doing what the body should be doing naturally, eliminating, removing these toxins and overgrowths, putting itself into a more favorable position. So that's why we take this approach. And on that level as well, so I've touched on that, but level 4 is looking into blood sugar regulation and thyroid regulation, and level 5 is looking into hormones. Hormones is at the very top, which means it's the last thing that I'd actually focus on. Obviously, there's situations where I would look into it, don't get me wrong, but actually in reality, everything else below that affects your hormones. So if we look into blood sugar dysregulation, if we look into impaired liver detoxification pathways, if we look into parasites, if we look into poor sleep, all of that affects your hormones. So why the heck are we jumping straight to hormone therapy when we should be looking at everything below that, which are your health handbrakes? If we remove your health handbrakes, your hormones are going to be in a much more balanced position. You're not going to rely on medication or these short-term treatments. So this is why the hierarchy of health is so important.
So if I get this correctly, essentially what the hierarchy of health enables us to do is to put our body in a position where it can naturally heal itself rather than forcing the change or the healing through medication.
Yeah, I've seen people going with absolute nukes, even through the holistic realms as well. And that's where I'm looking at people taking so many antimicrobials in order to just remove a parasite or a bacterial overgrowth. And that's put them in a much worse position. And most of the times, I don't know if the audience is going to be able to relate to this, but sometimes you may feel a short-term relief from doing a protocol like that, but long-term, you're actually not in a better position at all. And that's because you skipped certain areas of health which need to be addressed first. If they haven't been optimized, then this is where you can be more susceptible to like infections again. So a fine example of this would be low stomach acid. Stomach acid declines as we age. If we've got low stomach acid, this can make us more susceptible to infections. So if the low stomach acid was the issue for us actually having a parasite or a bacterial overgrowth, and we've just gone into to then remove the parasite or the bacterial overgrowth, we've missed the main area, the root cause, which led us towards the susceptibility of actually getting that infection. So that's why 6 months later, you're back where like you were 6 months ago.
You know, as I speak to more and more people on this podcast, everybody has their own unique approach. Some people are coming more from, let's say, like a spiritual realm. Somebody is coming from more like with a science background. But I start to see the overlaps here. So I had this podcast with Mikey Breeds. It's been like a month or so. And then we also touched on parasites. And he was saying that the reason why parasites are in your body is because you're a suitable host. So if you are not fixing the root cause, they are keep on going to be coming back. So if I take that statement and apply it on what you just explained, it's pretty much the hierarchy of health. That
yes.
Like if I'm able to fix like level 1, 2, 3, 4, 5, right? Then essentially like having this kind of like very quick fixes of like, you know, like a parasite cleanse or even like any of those quick protocols, maybe I have a momentary relief, but if I haven't fixed the underlying foundations, then it's just going to be keep on happening again. And I may have already damaged myself even more.
Yes,
by doing this kind of quick fixes.
Yeah, because a parasite cleanse in reality is a bunch of natural antimicrobials, or some people may decide to go down the conventional route and take antibiotics. But either way, we know that is going to cause some disruption with the gut microbiome. So now we're altering that. That's now changing everything else in the body, because we know obviously gut health is going to have a systemic effect. So if we suddenly alter that without knowing what the effects are from that, or without actually addressing the root cause, of course, we could end up even in a worse position than before. So we have to recognize that. So yeah, you've nailed that.
So then I guess like I just have an assumption what your take is on parasite cleanses, liver flushes. So can you maybe just explain like where do you stand on this protocol? So what do you think about parasite cleanse?
Okay, so I think they can have a time and place. But the problem is that we still have to recognize that the body needs to be in a position in order to handle these cleanses, to handle these certain protocols. So again, if we look into the liver, that's on level 2. So if everything isn't addressed on level 1, then of course, we're not going to end up in a better position. Short-term relief maybe, but we know long-term, we're going to be better off. Dependent, obviously, it is very individual dependent, but we're still obviously, unfortunately, missing the hierarchy of health. And then with parasite cleanse, I think the problem with the parasite cleanse world at the moment is the fact that people have demonized parasites. This is going to be quite a cool one, and probably something in which you didn't expect me to say, but parasites aren't always the devil. parasites can actually be very protective for the body. So can candida. That's why candida can show up more when a person is stressed. So what we have to recognize is actually how to reduce stress for that person, whether that be mentally or physiologically, in order to then get them into a position where they're not at risk of getting candida. The same with parasites. If we look into parasites, parasites are actually used for autoimmune therapy. So all of a sudden we're thinking, wow, so actually these parasites could be doing a good job for me. I've worked with so many clients where I put their foundational levels and level 2 in a better position where they've started to pass parasites naturally, which meant they didn't need to do some harsh cleanse, which could have left them off in a worse position. That's how I feel about it.
And then there's another recurring topic that kind of shows up on my social media feed very frequently is liver flushes.
Yes.
What do you think about liver flushes?
Again, can be very dangerous. I think with a lot of these protocols, we need to recognize the side effects in which they can cause as well. So there's multiple reasons for that, right? And it's going to be different for everyone, but that's why I really want to make sure that everyone is putting their body into the best position possible, into a stable position where their body can potentially handle that flush, let's say, for example. So for me, it's very extreme. And if we're having to do anything that extreme, then it needs to be questioned of why. Like, it's never going to be just one thing. It's not going to be just the liver, for example. There's going to be other things going on in the body. And unfortunately, if we do look into some reviews, if we look into other people's experiences, you will see how they've actually been left in a worse position from that, which is something that we have to obviously respect and take seriously, because again, it isn't always the answer. What I truly want people to take away from this podcast is understanding that it's never just one thing. We shouldn't be looking at anything in isolation. We need to respect that the body works synergistically, so we need to be looking at it as a whole, and that's why we want to be looking at it holistically rather than obviously just as that one thing. So yeah, I personally wouldn't go in with a liver flush. I'd be more looking at what is impairing certain pathways. That way we can put the liver in a better position to naturally do what it should be doing.
So some of these like very popular protocols nowadays, they definitely do something, but if you do it at the wrong time, then it's not going to get you the right effect. So can you maybe just like one more time explain the levels? So what was level 1, 2, 3, 4, 5 in the hierarchy of health?
So the main ones I'd focus on are level 1 and 2 to begin with. So level 1 is like the nourish phase. So basically making sure that we replenish nutrient deficiencies. We're also putting the upper GI in the most favorable position. So upper GI could be something like low stomach acid, which we touched on earlier. So we want to obviously make sure stomach acid is in the best position possible in order to assimilate and absorb nutrients. We also want to be looking into sleep. We want to be looking into mental health. We want to be looking into our environment. We want to be looking into our hydration and electrolyte balance as well, because that's going to look different for everyone. And then the next level is when we're looking to barrier integrity. Now, this could be pulmonary barrier, so like lung barrier, it could be brain barrier, it could be intestinal barrier. There's many different barriers. There's even skin barriers. So we need to be looking into barrier integrity as well as detoxification pathways, and we need to be looking into drainage pathways. So that's the restore phase, that level 2 phase. And then we've got level 3, which is the defend phase. So making sure that we have more immune resilience. So what I mean by that is if we need to, that's when we're going to be removing certain overgrowths and parasites, for example. But we have to make sure that level 1 and 2 are in a good position first before going in with anything to remove them. And that way, from just doing that, you'll then actually see that your thyroid's going to be in a better position. You're going to see that your blood sugar management is going to be a lot better. And you're going to see that your hormones are in a much more favorable position as well. So we don't even have to do direct work necessarily on the level 4 and 5s. Obviously, there's going to be situations where we do, but at the same time, we have to respect that we still need to address everything else below that in order to actually address the root cause.
So there is like quite a few things that as a regular person like myself like need to keep in mind. So how can someone actually identify where they currently at in the hierarchy of health? So like how could I know what I need to prioritize first?
So the biggest thing, again, that I see a lot of people overlook, like, as you know, and I'd recommend everyone here, get your blood work done and make sure obviously it's being interpreted to the deepest of levels, because that way obviously the practitioner is going to be able to have the correlations, the patterns, and recognize trends in order to know exactly what it is in which you need. So blood work, as you can imagine, is a high skill. So you want to make sure that someone has the level to interpret it well in order to be able to see all of these things. Like even from blood work, we can see if someone's having issues with sleep, for example. So if their hemoglobin, hematocrit, red blood cells are high, this could tell us a little bit more about nocturnal hypoxia. So it could tell us more about their respiratory state of health. So therefore, we could ask the simple question of, oh, how are you sleeping at the moment, by the way? And whenever we're seeing this pattern and we ask that question, it's like, oh yeah, I do snore. And you're like, bang. So there we go. We need to focus on obviously reducing you snoring. So therefore you're breathing more functionally overnight, which is then going to have a huge effect on the rest of your health. Because if you've got your mouth open and you're breathing through your mouth and you're snoring, that's causing more stress on your body. So that's a priority to focus on. So we can see so much more than I believe most of the world realize we can see through blood work. So that's why obviously I'm a true advocate of blood work. But there is also the simple biofeedback, as I just mentioned there. Like if you're snoring at night, that's something in which you need to address. If you're someone who's constantly thirsty, is that possibly down to mold? Or is that simply down to you not drinking enough, or are you over drinking? So people can overhydrate as well. So what I mean by that is they're constantly drinking water, they have clear urine, and therefore they're not holding on to electrolytes. So we need to look into that. As we said earlier as well, like with the environment, if you're touching a wall and it feels quite cold, it feels damp, then obviously that could tell us that there's water damage behind there. So therefore it's more susceptible to mold. So that could be having a big effect on you. So yeah, this is where I truly recognize that every test, even blood work, can have its limitations. But when we marry it up with other objective data and subjective data, we can truly marry that up and validate what we're finding. So for example, if we are seeing mold, I could get someone to do a VCS test online, which is a visual contrast sensitivity test, and that could then show mold. And then I look into their health screening form and their symptoms are also related to mold. I'm pretty sure it's going to be mold at this point because there's 3 different ways we've just validated it being mold. So I hope that answers your question in a way, but the most intelligent thing I do, and this is honestly how I help so many people, is I educate them. I give them the understanding to health rather than just giving them a protocol and saying good luck type thing. I'm like, this is why we're doing this. Like, understanding how they feel and getting them to recognize the way that their body is working empowers them to make the changes, and not just changes for 12 weeks. We're talking lifelong changes, because life is going to throw shit at you. Like, we know that anything can happen around the corner. So it's about understanding what to do in them situations. So we have to be adaptable. We have to be able to adjust the plan. But in order to do that, we also have to have the knowledge to know what to do. So a fine example of this would be how, like, last week I got threatened by having a cold sore, for example. Like, I could feel a tingle on my lip. So I knew that my body was in a stress state. Like, it already started to whisper to me. So what I did is I simply reduced my arginine-rich foods and I had more lysine. So that way, obviously, that can then help me to recover from getting a cold sore and put me in a more favorable position. But not many people have that knowledge, which is why I'm so proud of what we have, because we teach that. So therefore, you have the education, you have the knowledge in order to make these changes. And it's always relevant to you, if that makes sense. Like, that saying there about the cold sore is going to help someone else. But for someone else, it isn't going to resonate. But this is why I'm so big on working with the person rather than working as a one-size-fits-all, which unfortunately we see so often.
You mentioned quite a few interesting symptoms as well that could be an indicator that something is not going according to what your body actually wants. So let me just bring another example, which I have faced myself many times at different parts of my life, and also so many other entrepreneurs as well, that it happens that sometimes you struggle with energy or mental clarity. If that's the case, that's what I'm experiencing, what would be the first thing that you would look at?
Honestly, I'd be looking at a comprehensive health screening form. The reason why that is just because it allows us to recognize your symptoms and relate the symptoms to what it actually could be. It's absolutely key. And I'm sorry that it's a more long answer and it isn't just one answer, but that's how we have to be able to actually truly understand what is going on rather than then guessing. So I'd want to understand all of your symptoms. I'd also want to understand your history of health as well, as we mentioned earlier. So certain events in your life could play a huge role with how you're feeling right now. And that way we could also be able to timestamp certain events, because what people often overlook is, yes, they're feeling like this now, but when did they start feeling like that? Was it post-COVID? Was it after getting COVID? Was it from a certain event which happened 10 years ago? Like, this is allowing us to timestamp what is happening and why it's happened. So therefore, again, we can come up with the right solutions rather than going, oh, you feel fatigued. Okay, that sounds like a mitochondrial dysfunction. Oh, okay, it's a mitochondrial dysfunction. So we're going to take some PQQ and some CoQ10 and everything's going to be magic. It doesn't work like that. Like, we have to find out a hell of a lot more.
What are those things that you just mentioned? Those two things?
PQQ helps to build mitochondria, and the CoQ10 is what helps with the mitochondrial function. But if someone's taking CoQ10 without having enough mitochondria, it's not going to be very effective, which is why I'm a big fan of PQQ as well, to build new mitochondria.
Okay. Well, I'm definitely learning a lot.
Yeah, I was just about to say, so that's a huge thing as well. Like, even understanding what supplements to take and when. I work with a lot of chronic cases. So one of the amazing things that I see is how supplements can be very much overstimulating. And actually, I had this with a client yesterday who I did say to be careful with, because they wanted to do a cognitive stack. So he works with sales. So he wanted to be obviously on the top of his game. And I was like, look, I wouldn't take all of these at once if you haven't taken them before, because what it can do is it can overwhelm the body, it can overstimulate it. He messages me today and he says, yeah, you're right, by the way. I actually had more brain fog and I actually started to feel anxious on the call. And I was like, yes, because you gave the body too much at once. Like, we need to recognize, again, with supplements, what can interact, how it's working on different pathways, and therefore how it could possibly affect the body, whether that be positively or negatively. Like, there's so much to know on this. And this is why I'm sure a lot of the audience have tried certain things in the past before and it hasn't worked to how it's been marketed, let's say.
Personally, would you take any supplements without having a blood test first?
There's ones that I'd feel safer with for certain, like magnesium, for example, which we know can have over 300 enzymatic reactions in the body. Magnesium would be my favorite one, and it would be magnesium glycinate specifically, because we know obviously that can help with the nervous system. It can help us to relax. And if we look into modern day society, we know there's a lot of stressors, and we know stress can deplete magnesium, and equally being deficient in magnesium can cause more stress in the body. So this shows a huge need for magnesium. Now, if anyone's taken magnesium before and they tell me they haven't seen a difference, I usually ask how much magnesium they've taken. And they're like, oh, I've taken one or two capsules. I'm like, oh, okay, interesting. Because if you're someone who's heavily deficient in magnesium, or you're someone who's heavily stressed at the moment, do you think 1 or 2 capsules of magnesium is really going to be enough? It's probably not. And if we look into the rule of thumb, sometimes what we're going to need is 10 milligrams of magnesium per kilogram of body weight. So someone weighing 80 kilograms may need 800 milligrams of magnesium. Now, in 1 or 2 capsules, there may be only 300 milligrams of magnesium, for example. Now, that's a lot under 800 milligrams. So therefore, obviously, it shows the need that someone may need more in order to actually see the benefit from a magnesium supplement. And then there's other things as well, just knowing which type of magnesium is going to be best. So if someone's got constipation, for example, magnesium citrate could be fantastic. I actually call it shit rate, because obviously it can help with constipation. So recognizing again what form of that supplement you need is going to play a huge role when it comes to your health. But yeah, magnesium is probably the only one that I'd say could benefit the majority of the world.
But again, like, what it also tells is that you don't know exactly how much of it you need, because like, you may be onto something that, oh, okay, I need magnesium. And then, okay, magnesium is safe. Magnesium is good. I'm stressed. I'm taking magnesium. So again, like, I'm doing something for myself, but I still don't know how much of it I need to take.
Yes. So this is where the blood work is going to be key, but also context. Context and nuance. Why is that missing so much on social media? It's because obviously it's a marketing game. So if we look into obviously the nuance with it, I've just said about maybe someone needing more magnesium. For some people who are in a very sensitive position and can find supplements actually cause an irritation in their body, overstimulates it, having that higher magnesium is going to put them in a heck of a lot worse position. So in reality, they may be the ones that only need one capsule to then assess their tolerance levels to it and slowly build it up. So this is why I'm always like, I can't just give one answer from one question. I need to find out a lot more about that person to actually assess what is going to be the best next steps for them.
Yeah, so I think like we are so exposed to all of these new ideas, protocols, different trends that we just come across on social media. And then like, oh, okay, I have this symptom, I'm going to do that. Oh, actually, that worked for that guy, so I'm going to do that. But when I do that, it actually is not fucking working for me. I'm actually feeling worse than I felt before. So it raises then the question, why do you think that common protocols like fasting, keto, different kind of supplements work for some, but hurt others?
I think it's because certain things do have a time and place. But I think the thing that gets overlooked is recognizing that our body is always changing. And that's why some people go, fasting used to work for me, but it doesn't work for me anymore. And that could be because they're now in a malnourished state. They're actually so stressed that their body needs more nutrients. It actually needs food rather than them starving themselves. So it's again recognizing what's going to get that short-term benefit for what they need at that moment in time and when to then move on to the next thing. And that's again almost comes back to the hierarchy of health, but yeah, it does come back to the hierarchy of health, and it's recognizing exactly when we then need to change things. So for example, with our clients, something I'll do is every 4 weeks, I'll get a monthly review call. Don't get me wrong, like I'm talking with them daily anyway inside the group, but we have a monthly review call, and that's when I'm assessing their past 4 weeks on the protocol and recognizing how they've responded to the adjustment. And therefore, if everything is going well, we can move on to the next phase. So rather than keeping things restricted or limited, we're actually encouraging them to increase their diversity, especially when it comes to their foods, when it comes to nutrition, because people are doing the same plan week after week, month after month, year after year, when we have to recognize following the same approach does show that there's going to be some restrictions, there's going to be some deficiencies, because there's not one meal approach which includes everything that the body needs, if that makes sense. Yeah, it's pretty powerful, isn't it? So yeah, it's understanding what approach is going to be best when. The way that I like to look at things is a certain approach, let's take paleo, for example, could be fantastic as a base, but we still need to modify that for the person, because there may be some things that the person needs because they're deficient in it that the paleo approach isn't going to actually give them. Does that make sense? So paleo could be the main approach of it, but then we may add broccoli sprouts to help with NRF2 activation, for example, to help with the detoxification pathways. So it's knowing little things like that of like what food to add into that base in order to create an even better response whilst limiting a negative response to the body.
So what it actually tells me is that, again, like we need to be mindful of the fact that we all are different. We are different human beings, and something works for some, something doesn't work for the others. So that would be like layer one of understanding. And layer two of understanding for me would be is that this Adam is not the same Adam as Adam was 2 years ago or 10 years ago. And this Adam is not going to be the same Adam as Adam is going to be like 5 years from now. So there are different kind of, let's say, like versions of me throughout time where I need to be mindful of how I am changing. So what worked in the past may not work for me in the present, and what's working for me in the present may not work for me in the future. So this is where understanding that our bodies are ever changing and evolving, it kind of leads us back to then like, how do I know which state I'm in? And this is where it ties back to the blood work again.
Yes, yeah, it comes back to blood work and assessment. So subjective assessments, because that way we can recognize where the symptoms have been improving, if there's any different symptoms as well, and how much the symptoms have improved, as well as looking into the blood work so we can see physiologically what's happening there. Like how much have we been able to move the needle? For example, let's just take a really easy one like vitamin D. Vitamin D could be absolutely tanked, so it could be very low. So could white blood cells. We know vitamin D helps with immune modulation. So let's say we increase vitamin D. Let's say it starts off at 30. I'm just going to throw a number, okay? We're going to aim for 150 in this case. So we're at 30 and we've been taking 5,000 IU for 90 days. And after the 90 days, that 30 has now moved to 100. So it's not quite at 150, but it's in a much better position. And we've also seen the white blood cells increase. So we know things are going in the right direction. So what we know is we want to continue with that for another 90 days, and then we can assess again to see where things are at. Recognizing if we then need to pull back, we could then also look into removing things before adding things. So this is the problem I actually see a lot, is people just think about add. Like, what else can I add into my life? What other biohack can I do in my life? They're not looking into what they need at that moment in time to then obviously then remove something before adding something new. So let's say with vitamin D again, levels are now optimal. Let's remove vitamin D because it isn't needed right now, but from your blood work, there's something else which is needed now. So now we've looked into removing before adding to not create an overwhelm for the body, because adding all of these things still creates this overstimulation for us where there's too much going on, and that's another stressor.
You mentioned protocol. So when you say protocol, you are referring to the Superhuman Protocol. Can you please tell us what is the Superhuman Protocol?
Yes, definitely. Okay, cool. So starting point is the blood work and the health screening form. So as mentioned, that's going to allow us to see your history of health. It's going to allow us to see your symptoms, and it's also going to give us a current snapshot into what's happening inside your body from the blood work. From that then allows us to understand what's going to be the best next steps for you when it comes to designing your protocol. When we look into what the protocol has, the protocol can go as in depth as you need, but the main things in which it covers are things like your calories, if that's something you're interested in. It covers your macronutrients. So if I come back to something we spoke about already on this call, low stomach acid, having over 40 grams of protein, if you've got low stomach acid, probably isn't going to be best, because we need stomach acid to help us to break down protein. So now we have to recognize how much protein per meal is going to be best for that person. If someone, as you said earlier, has liver issues, for example, going keto is going to be terrible because it's going to be high in fat, and that could then put their liver under more burden, could put obviously more overwhelm on it. So therefore we have to recognize, actually, if someone's got gallbladder issues or liver issues, gallbladder in particular due to obviously the insufficiency, the poor release of bile, then what we need to look into is 1 gram of fat per kilogram of body weight. So what people don't recognize is 10% of males in the UK in particular have something called Gilbert syndrome, but only 3% are diagnosed. So if we look into that, that basically impairs the way that we break down fats. So if someone's getting loose stools after having fatty meals, for example, that shows that obviously there's an impairment of fat breakdown. And this is, again, something that a lot of people don't like connect, but we can see it through the blood work. So now we're able to see protein from stomach acid. We're able to see fat digestion from obviously your lipid panels and your liver panels. We're also able to see if carbs are potentially causing more issues, if they're feeding certain overgrowth from your gut health profile from the blood work. So there's that side of it as well. So straight away, macronutrients are going to be key. We're also going to be able to see what micronutrients are going to be best for you, which then leads us on to seeing what foods are going to be best. So if someone has got these liver issues, we're going to know that cholesterol-rich foods are going to be best. So bitter foods, things like rocket, radish, ginger, that's going to stimulate bile production. This is going to help with us to release natural digestive enzymes to assimilate and absorb nutrients better. So key foods is so important, but also key foods to avoid is so important to look at as well, because if we have got these sort of gut health issues and we're having certain carbs which are feeding bacteria, that's not going to be great. Or if we've got oxalate or histamine issues, let's say you're in mold, so you're back in Bali and you're eating histamine rich foods, this could cause a histamine response, which is why some people could then show up in a rash, or they could get itchy skin, for example. It's the accumulation of things. It's not just their environment, it's what they're eating. So they could be eating histamine-rich foods, so we need to reduce that. So that's another side of it. And then we dive into lifestyle implementations. It comes like we give nutrition plans as well. Lifestyle interventions, so recognizing what's going to be best for someone. So coming back to the liver, that's where the sauna could be really good. But let's say someone is highly stressed, then doing a cold ice bath may not actually be best for that individual. It could cause even more stress in their body, because it is still a stress response from the body, right? Which can then cause possibly more like resilience, or it could also cause more stress for someone. So getting the lifestyle interventions is absolutely key. Coming back to mold, for example, in that case, we're going to want to use a neti pot or some sort of nasal spray potentially to help with the nasal microbiome, because you've been inhaling all of that mold. So it's not just affecting your gut microbiome or your brain microbiome, it's also affecting your nasal microbiome because you've been inhaling that. So we need to make sure that's in a good position as well. So that's where lifestyle interventions are key. And then we come on to supplements and peptides as well. well. So this protocol covers everything you need. And on the back of it, what you also get is expert support and guidance, because I've seen far too many protocols out there where you're handed a protocol and it's good luck. But as I mentioned earlier, we don't know what's around the corner. Life can change, your body can change. So we really need to make sure that someone is there who can adapt and adjust the plan as needed, when needed. So that's why I'm really big on the support side of things as well.
Oh, wow. So
yeah, that was a lot there.
it's not that. It's just already some of the things that you mentioned goes completely against what I believed was true. So one thing, let's say the ice bath. And I'm like, what? Like, really? Like, that was almost like, oh, like, I was almost like set on it that like, oh, ice bath is good for me. Of course, like, I don't have to do it every day, but especially when I felt, let's say, like stressed or overwhelmed, like putting myself in an ice bath, I actually felt it was helping. But you are saying that for some, it actually has exactly the opposite effect, and they are just making it even worse.
Yeah, because it's causing a stress response, right? Now imagine someone's already in a chronically stressed position, adding more stress through a cold ice bath is going to be terrible for them. It's a recipe for even more stress disaster. So we have to recognize what position someone is in. So it's kind of like I said earlier as well with fasting. If someone's in a stressed position or they're highly malnourished, fasting isn't going to be the best thing for them, when actually we need to get them into a state where their body is in a parasympathetic state where it can actually digest foods better. So we have to be looking to nervous system regulation as well, right? And that's even where obviously these things can play a huge role. So we have to recognize the power of which they can have and not just not fall into the marketing trap, let's say.
Yeah, again, it kind of like confirms it to me that we cannot really look things in isolation. So we need to look at everything holistically, and everything impacts everything. So let's say I cannot just like pick and choose that, oh, okay, I like the idea of ice bath and I'm going to start doing ice bath. Or I like the idea of like this type of diet, I'm going to start doing that type of diet. Because I just don't know what I actually need to do. And the best way to know is by actually having tangible data that tells me where I am right now. And these are the things that science tells you to do. And these are the things that science tells you not to do.
Yes, definitely. And also, I think one thing I haven't touched on, but I think will be really key for the audience, is taking the safest but most effective approach. Like, I'm sure some of you are like me, where you might see something and you want to go hard at it. But in reality, that can be the worst thing for you. So, for example, with ice baths, I used to try and stay in there for at least 15 minutes because that's just my like personality. I used to want to try and compete with myself as much as possible. So I'd start off at 5 minutes,
Yeah,
and next
same
thing
here.
you know, yeah, I'm in there for 15 minutes, and that's me for the rest of the day, feeling absolutely ruined, all for a competition against myself. So it's almost like understanding what's going to be the minimal effective dose for you as well. That's really key. And I'd rather someone start off lower and slower than go too far in and actually cause further issues, because I've seen that far too many times as well.
So I know that you are not just working with, let's say, like high achievers, but you're also working with a lot of athletes.
Yes.
So when you look at all of them, they come to you obviously for a reason, that they want to get better, they want to optimize themselves for performance, whether it's like mentally, physically. Like, what's one of the biggest misconception that they have when they visit you about their health?
Yeah, good question. I think it could almost be for athletes, it's the impact of training, definitely. Obviously, again, it's another stressor. So you can only train as hard as you recover. Classic line. But with athletes, kind of like I've just said, if you've got that competitive edge about you, you're always pushing your body. But in reality, you can only push it so far until you hit burnout or it feels like it's breaking, an injury occurs. So again, that's where the blood work is really handy, because we can see how stressed the body is and what's going to be best to then pull it into a more favorable position. So it may not necessarily be that we reduce the training load, but we increase the support for the body. So let's say if there's nutrient deficiencies, for example, by replenishing them, their body's already going to be in a better position to perform, most importantly, because it's recovering better. So when I say you can only train as hard as you recover, what does recovery look like? That could look like it from a micronutrient perspective. It could look like it from a biohacking perspective. It could look like it from a mental health perspective. There's all of this, which is why, again, it comes back to understanding the person and then knowing what that person truly needs.
Yeah, I can definitely see how I also like bought into some of these ideas that, let's say, like if I work out 2 hours, I need to rest 2 hours. But again, it's that's not the right metric to put on it, because the quality of that recovery could be vastly different compared to how I was recovering last week versus this week.
Yes.
Like my psychological state is also different now compared to last week.
Yeah. This is where the blood work is key. So I worked with an influencer. Some of you may see him on my page if you go and give it a visit. But if with this influencer, what he was doing is, because he creates content, he was overtraining. His body was undernourished. It was creating more stress for him, and that was impacting his sleep. So the one thing I got him to do for the first 4 weeks was actually reduce his training, because he didn't need to. He was doing it for the sake of it. And then what we also did is we focused on his sleep, recognizing it's a foundational part of the hierarchy of health. Within them 4 weeks, because we had his blood work before, we realized that his blood work, his testosterone was absolutely tanked. So this was a 22-year-old and his testosterone was lower than I've seen people was in their 60s. So that's how low it was. But without the blood work, he wouldn't have taken it seriously. If someone just approached him and say, oh, look, dude, I'd recommend you to actually reduce your training a little bit and sleep more, he'd be like, oh, shut up, mate. Like, it's not until you've seen that objective data where your testosterone is absolutely tanked that you're like, oh my gosh, I'm 22. I really need to do like something about this. So within obviously the 4 weeks of focusing on them, we then got his blood test 90 days later, recognizing that was the focus. But 90 days later, his testosterone increased by 360%. So that's a huge improvement. And the main things we changed was his training volume and his sleep. And it can literally be as simple as that, because again, if we look at it, that is the foundation. Stress is part of the foundation. Sleep is part of the foundations. And that's what truly is going to have an impact on your hormones. If you don't get them right, your hormones aren't going to be in the most optimal position.
It's a bit of a segue into another question. We're gonna go back, but again, like this question comes up pretty often when I talk to men, which is the testosterone level. What's your take on TRT?
For me, it's a last resort. It doesn't mean that it's not a good option if it's the final option. So what I mean by that is too many people jump straight to TRT without removing their health handbrakes. So kind of like I've been saying on this podcast, is there's so many other things that we should be looking into before jumping onto TRT. Dependent on your age as well, obviously that's a huge factor. Dependent on your goals, dependent on what you want out of your life as well. So for example, if someone's a bit younger and they're wanting to have kids, then TRT isn't necessarily going to be the best thing. And also we have to recognize that some people jump on TRT at a young age, then realize that it's affecting their fertility. They then want to come off, but they can't come off because obviously the repercussions that TRT has had on their body, they feel like they can't come off. They're now dependent on it. So if we can actually look into removing the health handbrakes first and therefore improve the quality of your life long term, that's going to have a huge impact on the way you feel and obviously the way that you can then improve, it can also improve the way in which you show up in life. So yeah, TRT for me is a last resort.
So before jumping onto TRT, okay, that's the last resort. So you already mentioned a couple of things there, which was sleep and let's say like reducing the training volume for someone who actively works out. What would be some of the other areas that you would seriously consider in order to help someone to recover their testosterone levels?
Nutrition, absolutely huge. Like if we look into like, let's go with like, okay, this is going to be really cool. It's a bit different, but let's look into Tonka Ali, for example. So many people love Tonka Ali as a testosterone booster. If we actually dive into that a little bit deeper, what we do know that it helps with is the gut microbiome. One thing that a lot of people overlook. So all of a sudden we're thinking, actually, if Tonka Ali can help with the gut microbiome, is that the reason why it's then also helping with testosterone? So if we take a further step back from that and actually think what's affecting gut health, that can be your nutrition. So now if we look into your nutrition, that's going to have the biggest impact on your testosterone levels. So recognizing that. And then we look into the two most studied vitamins and minerals to help with testosterone. That's zinc levels and that's also vitamin D. So again, recognizing where someone's at. Again, this is really cool. So looking into like barrier integrity, this could be reliant on zinc. Low stomach acid, because it impairs the breakdown of protein. That could impair the way that you're digesting zinc. So if there's low stomach acid going on, and then there's a zinc deficiency, that's going to impact your testosterone. So it still comes back to the foundational levels of looking into your nutrient deficiencies, looking into your nutrition. And then vitamin D, let's say if you're not getting out enough, if you're not out in the sun enough, if you're not absorbing it, if your immune system is dysregulated, again, this is going to impact vitamin D levels because vitamin D can help with immune modulation. So again, if we can actually just look at these simple vitamins and minerals that the body needs, one, it comes back down to the foundations of health, the hierarchy of health, but it also shows how much that's going to improve your testosterone rather than having to jump into something like Tonka Ali as an example, which, by the way, Tonka Ali also has antimicrobial properties, which is why it helps with the gut microbiome, which is why it could also help with testosterone. So it's really cool to look at it like that. And again, boron, we could look at it from an electrolyte perspective, right? Like if we look into trace minerals, boron's there, and boron is something that's used for testosterone purposes. But if we look into the hierarchy of health, foundational level, electrolytes, hydration, boom. So that's why it all comes back to the foundational levels.
Yeah, I think people have the tendency that let's say that they Google their symptom and like, okay, I have this. And then the first thing, like the easy solution that kind of comes up, like, okay, I'm going to jump into this one. I'm going to jump into that one. But somehow, like they still know, like we all know that we haven't been doing great on the foundational level. But I think people just have this tendency that I want to have this quick fix without doing the hard work of, okay, having like a cutoff time from screen so I can go to sleep, or I'm not going to overtrain myself because let's say I'm compensating for something else that I'm psychologically going through. And it's just like so hard to pull those kind of breaks. And
yes.
So for example, I was thinking about something where I feel that my psychological state can impact my physical state. Let's say that if I'm going through something, which also I think so many people can relate to, that, I don't know, like there is stress in their life, whether it's like work related or relationship related or like other like personal stuff related or health related, then you don't really like rest because you are in this constant state of worry. And then when you go to sleep, even though that you spend, let's say like 9 hours in bed and you sleep for 8 hours and you also have like good, like, you know, like good amount of like REM sleep and deep sleep and all of that. But that worry is still there in your mind as you are sleeping. And even like sometimes it kind of like gets you out of sleep. So then let's say if somebody's struggling with that, like what would you suggest them to do? Like work on your like psychological state in this case first, or change something about the body?
Again, they go hand in hand because what we ultimately want to do is we don't want the brain to see threat. We want the body to be in a calm and safe position. So this is where, again, we have to work with the individual and recognize what stress management technique is going to be best for that person. Someone could go for a walk and feel miles better, whereas for those that have chronic stress, usually going for a walk does absolutely nothing. And they also then can find it very hard to get into a meditative position as well, just because, again, they've got that disconnect with their body. So there's recognizing what stress management technique is going to be best for that person is going to be the most important thing you can do. So that's, again, why we work with an individual to find out what that is, because it's going to look different for everyone. So yes, it's absolutely key to recognize what we can do from a stress perspective to reduce stress that's going to put you into that more favorable position, because breath work could be fantastic for someone. Humming could be fantastic for someone else. So yeah, we just have to find out what technique is going to be best. Does that help to answer the question?
Yeah, so it gives me back the exact same answer. What I thought was that, again, like it depends on me. So let's say that I say that it works for me, it's maybe not going to work for you. So you kind of like need to experiment and test what works for you, because maybe I feel like mentally better when I go to the gym, so that kind of like I feel less stressed. But for someone, it's exactly the opposite, that they like put more stress on their body and it's just not really benefiting them. So then it raises the question, how often would you do a blood test? Because like these things like can change every
Yes.
day, every week. So how frequently do you recommend your clients to do a blood test?
Awesome. So, dependent on their state of health, most times I'm going to go with every 90 days for the first year, just so we can appropriately assess the changes in which we should be expecting and equally be able to validate if it is working or isn't working, just so we can make the next appropriate changes as well. Obviously, we've got the biofeedback during that time, but the objective data from the blood work is also going to be key. So, that's why I'd go with every 90 days for the first year, and then I'd move it to 6 months, and then you could possibly do annually, for example. What we also have to recognize is some people may need further testing as well. I don't usually like to do further testing, but honestly, blood work has come on so much over the years that we're now able to recognize certain levels, certain numbers may require further testing just to put someone in a safer position. So, for example, from blood work, we can find out more about the potential for cancer now. Let's go with. We could find out more the potential of fibroids in the body. We could find out more about bone health. So, we may want to be looking into them at a deeper level as well. So this is where it truly is looking into preventative care now. And obviously it does depend on the client's budget, because there's so much we can do. Let's say if someone doesn't have the finances to do that, that's okay. Like, our basic test, which is very comprehensive, by the way, our basic test is still going to give us enough information to make a protocol to put you into a more favorable position. Because remember, we're not just going off the blood work as well. We're going off the way that you feel, as well as obviously your history of health. But yes, to answer your question in a nutshell, I'd go with the first year, every 90 days, just to truly assess the effects that it's having. Like, we've just got a new client who's worked with many different specialists, and she was on certain things, but she wasn't frequently getting monitored or checked. So she said it was working at first, but now she's in a position where it's not working. So this is what we have to recognize. Something may work at first, but then it could actually put us into a more harmful position. So this particular person was taking sodium at a high level, for example. So their sodium levels were finally into an optimal position, let's say at one point, but because they didn't get checked, they didn't get it assessed again, she then kept having the sodium, which then put her into high levels rather than being in low levels or optimal levels, if that makes sense. So we really do have to get frequent checks to begin with, so we can truly understand again the effects that these things are having on a person's body, because it is going to change for everyone. Their absorption rate's going to change. So that's why I'm really big on that.
Yeah, I think it's very important to acknowledge the importance of frequency, because you already mentioned it throughout this conversation that having access to that information where we can see trends is a key. So that's why you are also collecting the historical data on someone's health. And that's why the frequency of blood testing is important, because you can also see what's working, what's not working. So you can see how the trends are changing for someone specifically. And a few weeks ago, I had another podcast with a guy called Max. And what they are building is like a tech-driven blood testing platform powered by AI. And I can see that so many of these companies kind of like popping up in different corners of the planet. So there is Function Health in the States, there is Mito Health here in Singapore, then there is Lucy in Europe now. So like they are all based on blood testing. And then based on the blood test, they give recommendations to people together with their medical team and with the use of AI. So I wanted to ask, like, how does your approach compare to these guys' solution?
Yeah, definitely. Okay, cool. So I'm just going to jump back for a second, then I'm going to jump forward again. Jumping back into the reason why the frequency is so important is because we can have all this scientific data, we can have what works in theory from the research, but in reality, it may not work. So if I'm someone who uses AI, let's say, so it ties in with this answer as well, and I think, what is the best supplement to help with my liver? Milk thistle might come up. But the problem with that could be someone has got Gilbert, so they've got high bilirubin, so therefore they've got issues with the UTG1A1 pathway. So now what milk thistle can do is it can actually impair that pathway. So now all of a sudden it's causing issues with glucuronidation. So although the quick AI search says milk thistle could be good, in reality, it could actually put that person in a worse position. So this is why we also have to know more. So it also very much depends on the information in which AI has on that scale as well. So this is where experience is absolutely key. So we have to think about where is the information coming from, okay? So this is why we want to make sure that, well, realistically, I've got a mate actually who's making, funny enough, not an AI company, sorry, he's making his own health app at the moment. And what he's doing is he's using hard-coded algorithms which have been rigorously tested and developed from years of experience, as well as reputable published medical journals as well. So there's that side of it, because a problem that could happen with AI apps is how many are built by influencers or tech founders that don't have the experience in the health industry field. So they know how to do fundraising, but do they know how to get optimal results for someone? So that's what we also have to look into.
So the source of information is something for everyone to properly evaluate before they base their trust in an advice. And
100%.
having the historical data, the trends, that also indicates like this stuff works for you or doesn't work for you, that's also an important consideration. And this is where I actually find those solutions very interesting, because I'm the person who travels around, moves around, and I get my test here. So I get my blood test done in Hungary, then I get it done in Denmark, then I get it done in Indonesia, then I get it done here and there. Where my blood tests are, I have no freaking idea, right? So there is like literally like no documentation of how things have been working for me and changing. And this is where
Yes.
I found, let's say like Lucy in Europe, that's run by Max and his team, that they store all of that information, and then you always have access to it. You can see the trends, you can see what's working, what's not working, but you still feel that the recommendation that they may give at the beginning, at least, is still not going to be something that you would 100% rely on, even if there is like an artificial intelligence involved in that.
Yes, because we all know, like if we're being completely honest, there is inconsistency and unreliability with AI. Like we know that from a hacking perspective, we also know it from an exam perspective as well. Like it's not like AI has got 100% on a medical exam, for example. Like we've got to look into that. And then you said another key thing, which ties into what I was saying earlier, is recognizing where that data is coming from. Like what ranges are they using for the blood work? Are they using conventional ranges? Are they using the old functional ranges? Are they going off the least associated cause of mortality ranges? Are they being gender specific? Are they being ethnicity specific? Are they being age specific? Like how much research has really gone into building this app? This is what we have to find out, because at the end of the day, if the ranges aren't suited to you as a person, to your age, to your gender, to your ethnicity, based on previous blood work as well, or history of health, on symptoms as well, is it really going to be able to give you the best picture to move forwards? Or is it just giving you data which isn't actually that meaningful?
Which could be definitely a consideration in the early stages. But let's say that if I work with one of these companies and they know all of this, what you just mentioned, my gender, my age, my medical history, I have already done, let's say, like 10 blood tests with them. So they have all of that. And I've been also doing a good job documenting what I am actually doing and submitting that information to them so they can start seeing the trends and the patterns. There is a stage where they are going to have enough information about me to understand me very well. And they already have experience through their medical team and medical professionals as well to feed the recommendation engine that's powered by AI, that we are going to reach that stage where like, okay, this is actually useful. And like it's going to make almost like no mistakes, or at least not more mistakes than a human being.
Yes, it definitely will build up the validation. There's no doubt about that. And it'll get to understand you more as a person. So there's a few factors to look into that is, are you wanting to wait around for that? Because if we look into it, that could take many of years to get to that position, whereas there may be other things already out there or a person out there who can understand a lot more right now. So it could put you into better position now rather than later, if that makes sense. So there's that side of it. There's also the other side, depending on the person you are as well. Do you want to work with a person or do you want to work with AI? So there's that side of it. Like, would you rather have something in your life which is going to bring you more of the social side of things, like being involved in a community? So that's something I'm huge on, is community, especially post-COVID. Like community, I think we've all realized how powerful that is, and recognizing that we aren't alone on these journeys. There's other people who can help to inspire us, and also we can get different perspectives from people in that community as well, through understanding what they've been through can help us to feel a lot safer and calmer as well. So there's that side. There's also another side that I feel may not be being looked at as well, is looking into how obviously some health tech companies could potentially be using AI in an uncontrolled environment that obviously doesn't pass the data protection policies and therefore increases their vulnerability to cyber attacks. So we've seen this before in the past. There's things that have leaked data, personal data about us. So we have to truly understand that as well about the app. Is it actually in that position where it is complying with the data protection policies? Or could it potentially have this outbreach where it does leak our data as well? So a lot of apps aren't built with the correct standards, such as HL7 compatibility and ISO 27001. So with that in mind, it only takes one lawsuit and the whole house of cards could fall down. So we have to be really mindful there as well. It's a different angle to come at, that's for certain. But again, it's still our health. So if our data is breached, that could actually put us in a position where we then have a lot of anxiety and worry.
Yeah, so there's definitely a couple of factors that we need to consider before we choose our preferred method. There's one thing that I would like to dive a bit deeper into, or at least just to make a comment on that, which was your decision between whether you want to work with a person versus with AI. And
Yes.
that's a great question. And I was thinking about this a few weeks back when some of our friends showed the training regimen that they are following that was built by ChatGPT, which on paper actually looks legit and it looks good. And then I'm like, okay, you can definitely do that. But what I always found even more important is the accountability component. So let's say when I work with a coach, that creates a very different kind of dynamic for me, that somebody holds me accountable. Of course, I'm sure that there is some solutions where the AI is going to hold me accountable, and then like I have that kind of like same motivation or accountability for myself as well. But the other element that you mentioned, which I think is also very important, is the community side of things, that you don't feel alone. Right? Like you have a sense of belonging, that what you are going through right now with your health journey or whatever transformation you are on, you are not alone. And of course, it's your path and yours only, but there's some other people who are going through a similar journey on their own ways. And that creates like so much more safety and motivation and inspiration that can further enhance that as well. So I just wanted to make a comment on that because I also find it really important.
Thank you. Yeah, I've actually noticed with quite a few clients is they're the type of people who love to be involved in communities, and they can feel a sense of safety, a sense of satisfaction from being there for other people as well. So they're using their own health challenges in order to help other people. And that's what's making them feel better about their health challenges as well, because they're able to share the experience and help other people. So that's putting them into a more favorable position. So that's where the community side for me is absolutely key as well.
So we all agree on that. There was another thing that you mentioned, which I feel a bit conflicted by, is that you mentioned that with the AI, it's going to take quite a few years in order to get to a level right now, let's say, like a person can recommend who has the experience,
Yep.
right? Um, I think like AI is evolving super freaking fast. So I think we are actually going to get there sooner than we think. So let's say that if we would take all of your knowledge and put it into like an AI module, let's say like AJ AI, right? And then there you go. Like I have my own AJ who is going to help me with all the recommendations. And that's already possible to do
Yes.
nowadays.
So that still comes back to the person, right? So you're still wanting to look into who you're investing into, who's built that app, where are their knowledge at, where is their experience at, because that's going to dictate the way that then the AI responds. So that's absolutely key to look into. Because if there's certain things around multiple people building an app, don't get me wrong, their experiences can combine and be effective, but also where has their experience come from? Where is their knowledge coming from? Is that really something you want in order to help with your health? Is it definitely going to help your health? So understanding more behind the investors, behind the people who are building the app is absolutely key, because what I build or I feed into ChatGPT is going to be very different compared to what someone else feeds into ChatGPT. And I'm still trying to work with AI myself, but there's still mistakes that I notice from AI that I recognize it could have done better on. It may give me stuff where I'm like, oh, that's awesome. I may have overseen that, but there's also things where that can oversee things as well, if that makes sense.
Yeah, I definitely see that so many of these solutions are going to start popping up. In fact, I know that there's already some that, for example, Tony Robbins used in order to create his own Tony Robbins AI, which I also bought it for a month just to see what it can do. And it's absolutely mind-blowing. So I feel that it's going to be more and more available for people like us as well to load our information, our knowledge into these modules, and people have access to like AJ 24/7, which leads me to my next question. Like, where do you see like personal health is going to be in the next 5 to 10 years?
What I'm thinking is personal health is still going to involve an app, but I'm going to make sure that I'm using an app which I know is one, very safe from a data perspective, as mentioned earlier, but also has all of the hard coded algorithms to what patterns and correlations are actually needed in order to put someone into a more favorable position. So that's another thing that I didn't mention, but look into the amount of patterns and correlations that app has. So if it's only got 50 patterns and correlations, you're missing out on so many. There's so much more to find out about your health through blood work. So there's that side of it. Because if we can then utilize the right app, that's obviously going to be able to tell you, even down to the T, because I've seen what my mate is creating, is the percentage of a deficiency in which you have as well, or percentage of threat that something is to your body. And then you use that to then understand the hierarchy of health model, because then you're going to be able to see what is the priority to focus on. So I do think apps are going to be there, but I also think that there's still going to need to be that human touch element. So I would like to still see that in 5 to 10 years, being completely honest. Otherwise, I think it's going to change the way humans are even more, because we're still very much in an era where we are reliant on feedback from AI, for example, which can take away that human element, which I think is needed for critical thinking, which is why I think obviously that's going to be very important still.
I think I have a bit of a different angle to this, though, that I definitely see that AI is going to make information almost obsolete that's coming from a human being. That meaning that AI is going to know everything. So in terms of like information, I don't really see how AI is going to be, or I don't, in terms of information, I don't see how a human being can be better than AI, let's say like 10 years from now. If you see the development that we have been through over the past couple of years, it's absolutely crazy. So in 10 years from now, it's going to be even more insane. So in terms of information, I cannot see how AI is not going to be better than a human being. maybe they are also going to be making it even more relatable. And
Yeah.
then you are going to feel that you have a personal connection with this module,
Yeah.
right? But yeah, I can also see how people are always going to crave human connections one way or another. I don't know if this is in this kind of like realm, that's exactly what they are going to be craving, that I need a physical, like flash human coach in order for me to accomplish what I would like to accomplish. Maybe I can replace it with AI, but there's always going to be like a human element that they are going to crave one way or another. So I would love to get back to this topic at some point in the next couple of years
Yeah,
because
please do.
it's so hard to predict it.
Yeah. We should have a ring run every year just to keep track of the progression in which it's had, because it is going to change thick and fast, as we know. And yeah, it's going to be really interesting to see what data it's also giving us, because you're right, like AI can retain data that a human just physically can't, or it can create ratios, patterns, it can come up with the correlations a lot quicker than what a human has. But that's where it still always for me comes back to what human is feeding the AI, because that's going to be the most important thing in my eyes, recognizing that many people can have different perspectives of health. Many people can have different sort of research elements as well, right? So there has to be some sort of controlled variable on that and some understanding behind what we want to work with, or still who we want to work with, because they've still built the bot.
Yeah, yeah, very fascinating topic indeed.
Yeah,
I have a couple of like fire questions for you.
let's go.
So quick question, quick answers.
Let's go. Okay. I'll do my best to have a quick fire answer.
Okay, so if you could get everyone to understand just one thing about their health, what would it be?
It's always bio-individual. What works for Sandra or Mark down the road doesn't necessarily work for you.
Very important.
Mm-hmm.
What's your number one personal non-negotiable when it comes to staying in peak performance?
The foundations when it comes to the hierarchy of health, recognizing that we have to have our upper GI in the most functional position. We have to obviously make sure that we're not nutrient deficient. We want to prioritize our sleep. We want to make sure that the psychology is in the best position possible. So mental health is going to play a huge role. We want to make sure we're in the correct environment, that's internally and externally. So it includes the people that we surround ourselves with, as well as making sure that our hydration and electrolyte balance is as optimal as it possibly can be.
If someone is feeling off, overwhelmed, or burnt out, what should be the first thing they do?
Get a blood test and get it interpreted by a practitioner that can see it through a functional lens.
Yeah, that's awesome. If you could roll out one experiment to every single person on the planet that would help them to increase the level of their health, what would that experiment look like?
For me, it would be creating a deeper connection with self. So this could look like sitting at the beach. It could be going for a walk in nature. It'll just try and bring us back to as much of a natural state as possible. So removing all distractions and seeing how much that improves someone's health, because it means that we have to truly be present, whereas we're in a world which is full of distractions.
Oh yeah, 100%. I think that's probably one of the number one challenge for most people out there. One last thing, you mentioned this before, and I wanted to ask you for clarification. You told me that not being sick for a long time is actually a bad sign.
Yes.
What did you mean by that?
Okay, so we've seen certain patterns through our years of experience where actually some people have been in a more unfavorable position from not being sick for a long period of time. And this can be because they're in a certain dominant state. So if we look into the immune system, we have different T helper cells. We have different sort of states. So we have like Th1, we have Th2, as mentioned earlier with salt, that can obviously cause a Th17 response. So we don't want to be stuck in any one particular position, right? we always want to have that adaptiveness. We want to obviously be able to have certain exposures and challenges for our body to actually be adaptable and responsive, because that almost trains our body how to then obviously recognize certain patterns, how to recover from certain cytokine responses, how to obviously create antibodies or help with the antibodies in order to put us into a more favorable position. So if you never get sick, especially in environments with like regular exposure to children, traveling, work, it could mean that the immune system isn't responding appropriately, which, as you can imagine, if your body's not giving you the signs that it needs, then that can put you into a more harmful position. So that's absolutely key to understand. So don't always think that not getting sick is a good thing. It can actually just show an underactive or suppressed immune system, which is something that needs to be addressed still.
So how do I know? How do I know if I'm just being extremely healthy or I have a suppressed immune system?
Blood work. That's going to show us where your markers are at. For example, people with low white blood cells may not feel like they have immune challenges. They could turn around to me and they go, "Oh, but I never get sick." Oh, interesting. But yet your blood markers are showing that you're in a chronic immune state at the moment. You're also showing that there's an autoimmune flare up, not an autoimmune flare up, but there's also signs of autoimmunity. So straight away, this could be a disconnect to the body and not understanding what it's trying to tell us. So blood work is going to be the best thing for us to actually understand what is going on when it comes to our immune system, even if we're not getting sick.
Well, I guess this is an amazing reminder to everyone.
Yeah.
Boys, girls, ladies, gents, get your blood work done.
Yeah.
And then build from there. So don't just like jump onto all the stupidity on social media. Get some real tangible data and then build on top of that.
Yeah, definitely. Yeah, I was going to say in a nutshell, possible immune suppression, impaired inflammatory signaling, could be stealth infections or immune exhaustion. It could be weak immune adaptability. It could be microbiome stagnation. There's many different reasons. So yeah, definitely get your blood work checked.
Amazing, amazing. Well, thank you so much, AJ. I have already learned a lot on this call. Is there something else that you would like to put out there before we wrap it up?
Not necessarily. As I said, I just always want people to appreciate that everything wants to be bio-individual. Like, you are a unique person. You aren't like anyone else. So what's going on inside you should be addressed specifically for you. And equally, what we want to do is we want to create the education behind that so you know what to do to put yourself into a better position. Whereas if we're just getting random information and we're just doing it without understanding the whys behind it or the hows behind it, then unfortunately that isn't going to allow us to learn long term what can truly help. And like Adam said earlier, like, your body's always changing. So what works now isn't necessarily going to work in even 3 months' time. But that's why we want to keep making sure that we're on top of our health, we're assessing what is going on. And most importantly, that still comes down to connecting with your body. So even if you don't get blood work, really try and take the time to understand what is going on inside your body, inside obviously your mind, and also, as we first wanted to touch on, appreciate that both psychology can affect physiology and physiology can affect psychology. So don't look at anything in isolation.
Well, amen to that. I think that's the part for today. And for the next time, we need to talk about peptides. We haven't had the chance today to dive into peptides, but I think that's also a fascinating area. So we are going to save that for another time.
Yeah, and again, still deciding what peptides are going to be best for you, it comes down to your goals, your symptoms, and blood work, again, to make sure you're in the safest position.
Yeah, blood work.
We get it.
Awesome. Yeah, thanks, AJ. This was great.
Awesome. Thank you very much.